Great, so I think we can slowly go ahead and get started. So good morning, good afternoon, and good evening, everyone, and welcome to today's Norms and Behavioral Change talk. My name is Samira, and I'm the Managing Director of the Center for Social Norms and Behavioral Dynamics here at the University of Pennsylvania. Thank you all for joining today's talk, and usually what we have is in the first couple of minutes, we have people slowly but surely filtering in. Yeah, to go over today's agenda, our main talk today will be led by Dr. Giulia Andrighetto from the National Research Council of Italy. After Giulia's talk, we'll have a Q&A segment open to all participants towards the end of today's session. For those of you who might be new to this series or to the Center for Social Norms, the Norms and Behavioral Change talks are organized by the Center for Social Norms and Behavioral Dynamics here at UPenn with the support of the Philosophy, Politics, and Economics program, and in partnership with the Master of Behavioral and Decision Sciences program. The center itself is a research center which provides specialized consulting, research, and training services to organizations throughout the world seeking to enact positive behavioral change. Now here you can see the schedule of NoBeC talks that we have lined up through the end of this year, as well as upcoming talks in the first half of 2024. You can visit our website for more information and also to register for these upcoming talks. And as a quick side note, for our talks in 2024, we are very much open to interest from and suggestions for early career researchers. So either current or recently graduated PhD students or current or recent postdoctoral fellows who may be interested in offering brief 5-minute presentations during our talks next year. So I'll go ahead and once Giulia gets started, I'll put my email address in the chat so that if you yourself or if you have suggestions of others who might be a good fit for this, if you can share those suggestions, we would really appreciate it. Lastly, before we turn to our main speaker, we just want to note a couple of ground rules. You should automatically be muted, but if not, we kindly ask that you mute yourself during the presentation. If possible, please do keep your camera on so that we can have a more interactive conversation. And for any questions, you can use the chat at any time or also raise your hand when we have the Q&A at the end of today's session. Lastly, the recordings of these sessions, they will be uploaded to our website and also posted on YouTube afterwards. So with that, we will turn to today's main talk, which will be by Dr. Giulia Andrighetto. Giulia is a research director at the Institute of Cognitive Sciences and Technologies at the National Research Council of Italy, where she is the coordinator of the Laboratory of Agent-Based Social Simulation. She is also an adjunct professor at the Institute for Analytical Sociology at Linköping University and senior researcher at the Institute for Future Studies in Stockholm, Sweden. Giulia, I'll go ahead and stop sharing my screen now so that as I just complete my introduction of you, you can go ahead and share your screen. So Giulia's research focuses on the emergence, enforcement, change, and decay of social norms and their effects on cooperation and conflicts. Her talk today is on the dynamics of social norms under collective risk. And with that, I'll hand it over to you, Giulia. And thank you again so much for joining us.
Samira, thanks a lot, and thanks to everybody for joining, and thanks to the organizers for inviting me. It's a real pleasure, and also for giving me the opportunity to present this work and to collect feedback and comments. So what I'm going to present are 3 works, and I will present them briefly, that study the relationship between norms, risk, and behavior, and in particular to understand how norms and behavior can be affected by risk, and in particular when risk changes. So the final goal of this is that of understanding whether social norms might support cooperation in these situations in which collective risk changes, or instead whether they are not effective. So as we all know, humanity is facing major health and environmental challenges, such as increasing temperature, natural disasters, and pandemics. And these situations pose large-scale collective action problems. Those are situations in which a group would benefit from a certain collective outcome, such as that, for example, of reducing carbon footprint, and then also reducing the possibility, alleviating the possibility of dangerous climate change. But individuals, single individuals, would rather prefer that are the others contributing to this common good rather than themselves. So urgent solutions are needed, and they can be taken from the top down, for example, through the introduction of new laws and treaties. But the large scale and fast development of these situations sometimes make legal norms too costly, too slow, and difficult to enforce. And this is when informal interventions, bottom-up interventions such as social norms become essential. So social norms are the unwritten rules that regulate our everyday life. We are all familiar with them. They are complied with because of social expectations and potentially because of the fear of punishment. Just to give you some examples, norms regulate the fact that we wait our turn in queue, in line by queuing, or also regulate the way in which we talk each other by listening when the others are talking, but also the way in which we greet each other by saying hello, shaking hands, by kissing 1, 2, 3 times, or new norms also of greetings, like the ones that emerged during the pandemic, that are that of greeting through the touch of an elbow to limit the spread of the infection. So they are so important that they have been defined as the grammar, the cement, the glue of society. There are many different definitions of social norms. The one that we adopt in this work is the one provided by Cristina Bicchieri, that defines social norms as sustained by empirical and normative expectations. So empirical expectations are people's beliefs about what others will do, while normative expectations are people's beliefs about what others think that one ought to do. So the first expectations describe the social world, while the second type of expectations also add the normativity, the prescriptivity. And according to this way of defining norms, social norms are not just the behavioral regularity, are not just the expectations, but they are a combination of the two. And I think that one advantage of this definition is that it decomposes the aggregate social norms as the result of individual expectations. And this allows to test the existence of norms to identify whether they exist or not, but also whether they influence the behavior that we observe, and also provide ways of changing norms that are socially undesirable. So on this account, norms can be said to exist if we observe the behavior and the corresponding expectations, but also they can be said to influence the behavior if people respond to both empirical and normative expectations. But so far, social norms have been mainly studied, examined in the context of stable social dilemmas. For example, Elinor Ostrom, in her book of 2005, she says that for social norms to be effective in influencing behavior without the need of enforcement, at least 2 conditions should hold. The first one is that they should be strong enough. And the second one is that the population that they govern, that they regulate, should be stable. This way, households, parents can transmit norms to the following generations or to their children. And also there is the possibility of creating a shared knowledge, a shared understanding of these expectations. So what she says is that the stability of the population is important. Other scholars claim that it's important that the environmental setting, the environment, is stable. But many collective action problems are nowadays characterized by uncertainty, risk, change. Think of climate change. The climate change is characterized by seasonal risk of floods and wildfires, but also the COVID-19 pandemic. We all know that there were waves with high infections and high mortality rates, followed by waves in which the infections were lower, and also the mortality rate were lower. So these situations, these contexts are changing contexts. And what is important, we think, to understand is how these changes might affect social norms, whether these changes can make social norms unstable, and if so, whether social norms will still be effective solutions to collective action problems characterized by risk. At present, there is no theory of how social norms and behavior might react to change, and in particular to several changes in risk. The tightness and looseness theory of cultures offers an evolutionary perspective, an evolutionary framework in which we can explore the effect that risk might have on norms and behavior. This is a theory that has been proposed by Michel Gelfand, stating that those societies that during their history have encountered many ecological threats or man-made threats tend to develop strong norms for promoting social coordination and for organizing social life. Those societies tend to become tight. Societies that are characterized by strong norms and low tolerance for violations. Otherwise, societies tend to be loose. This, as I said, is an evolutionary framework. So the effect of risk on norms and behavior is on a long time frame. What we wanted to understand is also whether risk might affect norms and behavior on shorter time frame. And this is the aim of the first work I'm going to present. This is a behavioral experiment. It's a long-term behavioral experiment that lasted 30 days. So to test the effect of a collective threat on norms and behavior, we decided not to have a standard experiment lasting 60, 90 minutes, but we decided to have subjects playing with us for 30 consecutive days, because we thought that this might help and allow social norms to emerge, to change, and to crystallize. So the two main questions that we wanted to address is to understand whether high collective threat can make social norms stronger, and the second one, whether strong norms might also promote cooperation to overcome these collective threats. So the setting that we use, the game that we use, is the collective risk social dilemma, an adaptation of this game that has been used and proposed by Milinski and colleagues in 2008. So groups of players, typically 6 players, they each receive an endowment every day, 100 tokens every day. They have then to decide how much of these tokens to contribute to a collective fund. They know that the fund needs to reach a certain threshold, and we set that threshold at 300 tokens. Only if the threshold is reached, then the disaster is averted. Otherwise, if the threshold is not reached with a certain probability that is known to the subjects, a disaster would occur. And this would mean losing all the tokens, those that were put in the pot and those that were kept privately. In this game, the Nash equilibrium depends on the threshold. So below 0.5, that is the threshold, the only Nash equilibrium is that of contributing 0, while at the threshold level or above, there are multiple equilibrium, that of contributing 0, for example, or 50. 50 is the fair share that if each of the 6 players contribute is enough to reach the threshold. Let me give you an example. So there are 6 subjects. They all receive 100 tokens. They have to decide how much of these tokens to put in the pot. In this case, they put in the pot 310 tokens, and the catastrophe is avoided because it's above 300. In the second example, again, 6 players, they receive 100 tokens. They have to decide how much to put in the pot, and they put 290. And there is a disaster probability of 0.6. So if the disaster does not occur, players keep for themselves what they did not put in the pot. So they have an incentive to not put money in the pot, right? If the disaster does not occur. But otherwise, everyone loses everything. So every day, that means at every round, we ask subjects to take their decisions, their contribution decisions. So we ask them, how much will you contribute from 0 to 100 to the collective pot? And they have to put a number. Then every day, again, either before or after the choice, we measure their personal normative beliefs, empirical expectations, and normative expectations. As to the personal normative beliefs, we ask the following question. How much, in your opinion, how much should each person in your group contribute? And they have to put a number here. And these questions have been adapted from some questions that have been used by Vicchiari and colleagues in 2014. Then to elicit the empirical expectations, we ask them, how much do you think the other people in your group contribute? We don't just ask the average, but we ask them to write the contribution of all the other 5 members of their group. This would allow us also to keep track of the distribution. And this is for the empirical expectations. Again, they're asked every day, either before or after the choice. And for the normative expectations, we ask the following question. How much the other people in your group think that you should each contribute? In this case, again, they have to guess the personal normative beliefs of the other 5 members of their group. Both normative and empirical expectations have been incentivized so that the closer their guesses, the higher the bonus that they will receive in addition to the money that they receive from the game. So they have really an incentive to be accurate in the empirical and the normative expectations. Not every day, but every few days, they also face some hypothetical scenarios. And in which we ask, how much will you contribute if most of the other people in your group, and then we manipulate. So in one scenario, both empirical and normative expectations are high. So how much would you contribute if most of the other people contribute at least 50 points and think that you should each contribute at least 50 points? In another scenario, they are both kept low. So contribute less than 50 points and you should each contribute less than 50 points. And in the other 2 scenarios, so the empirical expectations are kept high, the normative low, and vice versa for the other scenario. After each round, they also receive feedback about the contribution of the other 5 members, whether how much money was put in the collective pot and whether the threshold was reached or not. And in case it was not reached, whether the catastrophe occurred or not. Let me say that subjects are not, they don't play in fixed groups, but they are reshuffled at every round. So at every round, groups of 6 subjects are recreated. So they don't play with the same people for the whole duration of the experiment. And we have tested 2 treatments. The first one in which subjects, and we had about 150 subjects, play for 14 days under a high probability of the catastrophe to occur if the threshold is not reached. So high means 0.9. And then after 14 rounds, the risk decreases to 0.6. In the other treatment is the other way around. So they start with a low intermediate level of risk, that is 0.6, and then they move to high. This is known, so they know that they are playing under a high risk, and then they know that the risk has decreased, or the other way around. Just an overview of the experiment. So the very first day, we ask our subjects a bunch of questions to have information about their personality traits, the big 5, and also the social value orientation to measure their prosociality, and also risk preference elicitation. This was done day 1. Then for 28 days, they play the game. And then the very last day, they go through a questionnaire. That's the game. We had, so this is the core hypothesis for this presentation. So we had also other hypotheses, but this is the main one for this specific work. So we expect stronger norms and greater cooperation when the collective risk is higher. And then also we expect a slower behavioral change after a change in risk when social norms are stronger. That's the idea. Let's move to the results. So let me first explain what we mean with norm strength. So it's a collective measure that indicates how established a norm is. And then we evaluate the strength using 3 different criteria. So the first one is the agreement between the expectation of the group members that we refer as consistency. The second one is how good those subjects, those participants are at predicting the behavior and the personal beliefs of others. So whether their expectations are accurate, empirical and normative. And the last criterion is whether these expectations are narrow or broad, meaning that the range of responses that are considered as appropriate could be broad or narrow. So the higher the consistency, the accuracy, and the specificity, the higher the norm strength. And the stronger a norm is, the stronger the impact in influencing the behavior. Let's now see whether the different risk levels have affected the norm strength. So the blue line represents the treatment that starts with a high risk and then goes to a low intermediate risk, so from 90% to 60%. The red line is the other way around, going from 60 to 90. And as we can see in both treatments in which the risk is high, the norm strength is higher compared to when the risk is low. So this is support for the hypothesis that high risk leads to strong norms. But let's now see whether this also translates into behavior. Here are contribution levels. So above, we see average contributions for the 28 days, while below, we see the proportion of groups that were able to reach the threshold. And again, we can see that in those treatments in which the risk was high, the number of groups able to reach the threshold were higher compared to those treatments in which the risk was low. But I think it's also worth noticing other two findings. One is that it's different if the high risk comes first or comes after the low risk. So there is a disadvantage for those groups under a high risk when this high risk comes after the low risk. So the level of, so their ability to reach the threshold is lower compared to when the high risk comes first. So, and another result is that it's true that under high risk norms, but also cooperation is higher, but when the risk decreases, both the strength of the norms and also cooperation diminishes. So they tend to diminish when the risk decreases. So taking together these results from this experiment, from this first work, seem to provide support also for the idea that norms and behavior are affected by risk also in the short time frame, not only on a longer time frame. But it's also true that these results were collected in an abstract environment of an experiment with subjects facing an rather artificial and abstract risk. So what we decided to do also to provide additional support for these hypotheses, we decided to test the fact that a collective threat, like the global threat of the COVID-19 pandemic, had on norms of different types. So at the very beginning of the pandemic in 2020, starting from March 2020 up to June 2020, we started collected and we administered a survey that was exactly the same survey that was administered in 2009 by Kimmo Eriksson, that wanted to study how meta-norms change across societies. So we took the exact same survey and we replicated that survey a few months later. So the first one was conducted in 2019. We have conducted the exact same survey in 2020. And there were questions in that in the wave one, so in the survey conducted by Kimmo Eriksson, asking about tightness and looseness using the questionnaire by Michelle Gelfand, but also asking about the social appropriateness of violating a set of norms in different contexts. For example, norms in restaurants, in libraries, in parks, and so on. There were, of course, questions about meta-norms, because this was the aim of that work. And then there were also questions about hygiene norms. So, and there were also questions in particular about hand washing norms. So subjects were asked, in which situations do you think people should wash their hands? Before eating a meal, after eating a meal, after urinating, after defecating, when they come home, after shaking someone's hand. And these questions were asked in 2019, and we had all this bunch of questions also asked in 2020, plus other questions measuring perceived COVID threat and number of cases, and also the government response, whether it was strict or was loose. And we thought that this could be the mechanism through which we expected the disease, the COVID disease, to affect social norms, for example, through fear. So we were not able to reach all the 57 societies. We were able to reach 43 societies, but in total, we had 29,000 subjects participating if we combine wave 1 and wave 2. So let's now move to the results. So the change in the appropriateness of the items is computed by scaling the average change in each country to the maximum possible change. And this goes from -1 to +1. -1 is blue, while 1 is the red one, while the light blue is it means no change. And all the red dots are the locations that we have tested, that we have reached. So we can see that for tightness and looseness in the short term, there is no change, that for situation-specific norms, there was no change. The same for meta-norms, but we did find a substantial increase in the strength of norms for hand-washing norms. And this was found in almost every country, at least 38 countries out of 43. And in particular, where the items, when do you think people should wash their hands, and where the items when they come home and after shaking someone's hands that were the one increasing the most? So again, this provides additional support for the idea that in the short term, a collective threat might affect social norms, but with caveats, because that specific threat had an effect in strengthening those norms that were relevant to cope with that specific threat. In this case, were hygiene norms, that were norms that limited the spread of the virus and also the risk of infection. So even then, in a crisis that was strong and global like the COVID-19 pandemic, in the short term, there was no dramatic change for general social norms and meta-norms. Maybe this was also expected, but those social norms that reacted to the change are those that were relevant to cope with that specific threat, in particular, hygiene and hand-washing norms. So taken together, these results seem to show, on the one hand, that the exposure to high risk leads to stronger social norms and cooperation. This is from the cross-country experiment and also from the long-term experiment that I presented. But also this evidence seems to show that when the risk decreases, norms tend to become vulnerable and they can get eroded and possibly abandoned. So what we want now to understand is what happens to norms when they face multiple changes of risk. What we want to understand is whether social norms are able to tighten up when the risk increases, but also to relax when the risk decreases, but importantly, to tighten up again when the risk increases again. So whether social norms might be adaptive and then can be effective solutions when they are needed. Or instead, we want to examine whether social norms are able to increase when the risk increases, to loosen up, but then they are not able to increase again when they are needed again. That's what we want to understand with the third study that I'm going to present. So the question is that to what extent social norms that have weakened can readjust to increasing level of risk. This is what now we want to understand. We want to understand these complex dynamics between norms, risk, and behavior. So whether social norms are able to adapt to changes in risk. And can still be effective solutions to promote cooperation in this context that are unstable, that change. And we have tested this question through a survey that we conducted in 2021-2022. It's a survey that consisted of 10 different waves. Some waves that were conducted when the COVID risk was decreasing, while other 5 waves conducted when the COVID-19 risk was increasing again. And we tested the effect of these changes in risk on the strength of the social norm of distancing. So of keeping distance in public spaces and in particular indoor. Why this specific norm? Because this norm was a norm that was prescribed by governments in almost every country. In Italy, for example, government prescribed to keep at least 1 meter distance when you are in a public space with other people around indoor. But then for this norm was very difficult to be enforced, because it was very unlikely that police could just go there and check whether that was the right distance to keep. So for this behavior, for this social norm, for this prescription to be effective, social norms were essential. So it was really important to have shared expectations that at least 1 meter distance needs to be kept. And also punishment was important, because it was important that people did not tolerate people staying together at lower distancing. That's why we decided to test not just the effect of risk and these changes in risk on the social norm of distancing, but also on meta norms, meaning on those norms regulating punishment. So whether people beliefs about the appropriateness of punishing a violation of that norm. So, as I said, this was a survey conducted in 10 waves, starting from June 2021, in a period in which the risk was decreasing, and we had 5 waves from June to August in which the COVID risk was decreasing. And then we had other 5 waves from October 2001 to February 2022, in which the COVID risk was increasing again. And we have conducted this survey using Qualtrics with a quasi-representative sample on gender and age, and we had about 2,000 subjects participating. So as COVID risk, as an indication of COVID risk, we didn't use just infection, the COVID-19 infections, but the mortality rate. Why is that? Because there were more and more people that were vaccinated in that period. And so the infection rate for people that were vaccinated maybe was not perceived as a risk. That's why, as a measure and indicator of COVID-19 risk, we use mortality rates. And as you can see, in the first period, in the first 5 waves, the number of deaths decreased from about 60 to 8, to less than 8, while in the second period, they increased from about 30 to more than 120. So to measure to measure the impact of risk on norms and meta norms, we use the scenario of keeping distance in a supermarket. Now here you can see a static figure, but this was a dynamic picture. So underneath this picture, they could see a slider moving. They could move between 40 centimeters and 160 centimeters. So that was how they could move the slider. And they were asked to move the slider to change the distance between people in line. And I will show you in a second the question that they had to face. And let me say that we asked, so were subjects living in Rome the ones participating to the survey, and also the questions about empirical expectations and normative expectations of the norm and the meta norm were about people living in Rome. So for the social norm of distance, we asked the following questions. So what distance do you think people in Rome participating in this survey keep when waiting in line in a similar situation. And they can move the slider from 40 to 160 centimeters. For the normative expectations, what distance do you think people in Rome participating in this survey consider socially appropriate when waiting in line in a similar situation? And again, they could move the slider. For the meta norms, we asked the following. So imagine that one person that in line thinks that the distance is too small and asks the other to please take a step back. So there is someone reacting. And then we ask, at what distance do you think people in Rome participating in the survey respond in a similar way when waiting in line? And they could move from 40 to 160. And at what distance do you think people in Rome consider socially appropriate to respond in a similar situation? So those were the questions for measuring norms and meta-norms. Then the hypothesis. So the first hypothesis that we wanted to test is that social norms and meta-norms of distancing decrease as the COVID-19 risk decreases. This is in line with the tightness and looseness theory of culture, but also with the evidence that we found in our long-term experiment. But there is no theory, as I said before, from which we could draw the hypothesis on the impact on norms of these changes in risk. Then we had two contrasting hypotheses. The first one is based again on the tightness and looseness theory of culture, that social norms and meta-norms of distancing positively associate with risk, so that when the risk decreases, they decrease, and when the risk increases, they increase again. So norms and meta-norms are able to adapt. But then we have a second hypothesis that is based on the compliance violation asymmetry bias. This is a bias that has been identified in some very recent work by Bicchieri, Diman, and Gachter. So it seems that subjects are more sensitive to instances of violations than instances of compliance. So it's necessary for them to observe less instances of violations to start violating the norm than acts of compliance. So we thought during a time in which the risk is decreasing, people start to observe a lot of violations. If it's true that there is this asymmetry bias, this could lead norms and meta-norms to become really, really weak. And then could be very difficult for them to recover when the risk increases again. So the alternative, the contrasting hypothesis, is that social norms decrease and meta-norms decrease, but are not able to increase again. So they get eroded. Results. So here are results for the social norm of distancing and the meta-norm for the first 5 waves and the second 5 waves. What we can see is that both empirical and normative expectations for the norm of distancing and for the meta-norm, they seem to decrease in the first 5 rounds when the mortality rate was decreasing. So they decline. What is interesting is that the normative expectations are always above 1 meter. So let's remember that the government were prescribing to keep at least 1 meter distance. And it seems that the normative expectations are the ones that represent these, capture this prescription the best. Meta-norms, they decline even faster than social norms. And it's also interesting to notice that there seems to be some tolerance. So people start thinking that it's appropriate to punish when people waiting in line, they don't keep a distance of at least 90 centimeters. So there is some tolerance. But again, with the risk of COVID, with the COVID risk declining, they also seem to decline. This is support for our first hypothesis. But then let's see what happens in the second block. So from wave 6 to wave 10. So you can see here the light line. So we use the observed relationship between risk and norms in the first period, so in the first 5 rounds, to extrapolate for the last 5 rounds the predictive levels of social expectations given the COVID-19 risk in the period when the risk decreased. So we wanted to see whether they also reacted in a similar way when the risk increased again. And we can see that, yes, empirical and normative expectations of the norm and of the metanorm, they seem to increase again, but with some delay and not completely. So this evidence doesn't provide clear support neither for the hypothesis that social norms are adaptive, nor for the hypothesis that they get eroded. So the process of adaptation is far from perfect here. And this can be problematic because if the risk increases again and norms are needed again, they are not immediately ready to help people to overcome the dilemma. So, and this is to show that the risk perception is a strong predictor of the social expectations. So social norms and metanorms seem to fluctuate with risk. They adapt to a re-increase in risk, but again, with some delay and not completely. And we also observe this asymmetry. So the weakening of social expectation goes faster than their strengthening. And if we think that this process of adaptation of norms and meta-norms is far from perfect, then we might think of possible interventions to help social norms to recover when the risk increases again, to have norms that are able to help individuals to socially coordinate and cope with that threat. And one possibility that we are thinking is that, for example, would be that of acting not on norms, but on meta-norms to reduce tolerance for violations. So if you reduce tolerance for violation, this might help then social norms maybe to recover faster. So let me conclude. So large-scale cooperation is needed to reduce collective threats like the one posed by climate change and pandemics. Exposure to risk and threats leads to stronger social norms and higher cooperation, but a decrease in risk also weakens norms. And there is need for a novel theory of social norms under recurrent risk. This is to identify when social norms are and when instead they are not effective solutions to collective action problems under risk. And then this theory might help to identify interventions for promoting long-lasting individual and system-level behavioral change. Future work. There is a lot of future work. We're already starting on some of these. So we want to collect more real-world data on the decay of social norms under changing risk, not just in the context of the COVID-19 pandemic, but also for testing the effect of other risks. It's not easy, because the COVID-19 pandemic was a situation in which there were these oscillations. We are also working on an agent-based model to understand this, to better understand this complex and feedback between risk, norms, and behavior, and also to understand whether there are some areas in which social norms might be better at readapting to new situations. We are also planning new long-term behavioral experiments to study norm formation and decay under repeated risks, again, to test these oscillations. And this knowledge might help us to identify novel interventions to help social norms to quickly adapt to new situations and possibly make them effective solutions to collective action problems under risk. So I would like to acknowledge the great group of collaborators that contributed and keep contributing to this line of research. And I would like to thank you all for your attention. Here is my email address if you have any question. But also I would like to say that we are about to open new positions, postdoc positions to work on these topics. So if there are people interested, please send me an email and so we can get in contact. Thanks a lot.
Excellent, great. Thank you so much, Giulia, for that. And now we'll just go directly into our Q&A session. I see there's a hand raised already. So folks, I just want to say before we go to the questions, please feel free to raise your hand or place any questions in the chat. And we'll go ahead and get started with Don Ross. Please feel free to unmute yourself.
Thanks very much. And thanks for that interesting talk, which pulled together 3 quite ambitious and interesting experiments. Great that you were able to jump on the COVID situation quickly enough to catch it while it was flying by. was a good opportunity, and grab that rare opportunity. I have two questions. First, you mentioned that you elicited risk preferences, presumably through a lottery choice. That would mean, in principle, I mean, did you could of course estimate at the individual level and see if whatever heterogeneity you observed in the risk elicitation played any role in the heterogeneity in response in the experiment and in the survey. I guess you didn't. You only did that in the experiment, right? You didn't have risk preferences, presumably, in the survey.
No, we just did it in the experiment, and we didn't find any. So risk preferences were not predicting cooperation in the experiment. This was surprising, very surprising, because of the type of game that we used. But risk preferences in the way in which we elicited, that is a very standard way, maybe it's not a complete way, was not a good predictor of the behavior. And also social value, the only predictor was prosociality and gender. So being a female and being prosocial were predictors of cooperation in the game, but not risk preferences.
Okay, that's interesting. And then my other question is with respect to the COVID experiment. One, did you consider or try to deal in some way with what one might think might have been a confound there, which is in the earlier COVID waves, people would not yet, I hypothesize that most people probably didn't expect to observe the level of normative controversy that by the second wave they would have encountered in the media. And right, so I think most of us naively thought that given that everybody had the same interest in not getting sick and not dying, there probably would have been relatively little controversy about policy. Then, of course, there was lots of it. By the time later waves of COVID rolled around, one would have been used to the fact, or we had learned that the level of normative alignment we might have expected wasn't there. And that could obviously affect expectations, and then through expectations, everything else.
Right, very, very good question. So I think for other type of behavior, this could be an explanation. For example, for norms of getting vaccinated, there was a lot of debate, and I think a lot of polarization on that topic. Was really controversial. For social norms of keeping distance, I think could be controversial, but maybe less than other behaviors. So you're right, possibly that could be a confound, but I think for other type of behaviors that were present, other type of rules present during the pandemic, I'm not sure about the social distancing norm, but right, I think that it's a fair point.
And the norms probably for aspects of the same phenomenon likely bleed into each other, right? So if one sees controversy about vaccination, that may be translated in part, at least, as controversy about everything to do with COVID.
Right.
Great. Thank you so much, Don, for those questions. Let's move on to some questions that are in the chat now. There's a question from Nicholas Diamond, and Nicholas writes, with COVID and other real-world collective action challenges, people have unequal access to information or misinformation about the actual level of risk. What role do you think this plays in the collective response to changing levels of objective risk?
Right. Again, a fair question, and so in the collective risk dilemma that I presented, so there was an objective risk, so that risk was the same for everyone, and but I agree that in real life situations that the perception might differ from subject to subject, but also from country to country. There were countries that were more affected by COVID because they had less resources, maybe to overcome that issue, but also for climate change is exactly the same. So there are countries that maybe are contributing less to climate change, but they are affected the most. So their perception of risk might be higher. So I think that this heterogeneity needs to be taken into account when trying to understand how norms and risk and behavior evolve together. Because I think that in reality, there is such an heterogeneity. So For the time being, especially in the experiment, what we had tried, so there was an objective measure of risk. Of course, then they can perceive that maybe in different ways. And we try to keep it constant, but in the real world, perceptions are very different. And also not just perceptions, also risk, the objective risk is different and needs to be taken into account.
Great. Thank you, Giulia, and thank you, Nicholas, for that question. We have another question from Thomas Asefa. And the question is, are people with different demographic backgrounds responding differently?
Apparently not. So we couldn't find any difference in the responses in the survey, in the experiment from people with different demographic backgrounds. So that didn't seem to affect the responses.
Okay, great. Thank you, Giulia, and thank you, Thomas, for that question. Folks, feel free to raise your hand or place any other questions in the chat. And in the meantime, as we wait for any further questions, Giulia, is there anything else that you might like to cover in terms of, you spoke about future work, and I know separately you also mentioned that right now you're going through a lengthy data collection process in parallel. So is there more that you can share? I'm also wondering, as a side note, in addition to the future work you mentioned, and this might be a question that's quite out there, but is there any work that you're doing in this space related to conflict, as that's also like a very like ever-present and timely issue at the moment?
So now the work, so we are not doing now work accounting for conflict. So what? So as I was mentioning, now we are developing this agent-based model. In which what we are doing there is, so we are based on the large-scale experiment that we conducted, the first study that I presented. In that experiment, we identified a lot of heterogeneity in terms of how people react to norms and risk. And so we were able to identify some behavioral types, and then we use these behavioral types to populate an agent-based model. And now we want to see how this heterogeneity might affect this relationship between norms, risk, and behavior. And it seems that it has a strong effect. Again, this seems to, I think, link to the second question, the question about accounting for heterogeneity in risk perception, but also heterogeneity in which people react to norms, in heterogeneity in the way in which people react to risk. This is important because if we want then to identify interventions, possibly it's better not to think of one single intervention, but maybe of multiple interventions that might target different types. So the other line that we are now trying to explore is the role of heterogeneity in this complex dynamic between norms, risk, and behavior. And again, I think that this is relevant. It seems to have an impact. And we need to better understand this aspect if we want to design effective interventions.
Great. Thank you for that, Giulia. I think, all right, we have one more question. So from Nicholas Diamond, the question is, any concrete suggestions for norm interventions in the next pandemic to restore norms when risk goes back up? Dynamic norm messaging about changing risk, question mark. And Nicholas is saying, I work for a government, would love to actually try to implement something.
Right. So if we, so I don't have suggestions, but if we look at the results from the last experiment in which we were testing the effect of risk on norms and meta-norms, it seems that the fact that meta-norms, meaning punishment, so the fact that people are willing to punish violations is so low. So people are very tolerant of violations of norms of keeping social distancing. And this can be problematic because if people are too tolerant, this might be a problem for norms to increase again when they are needed again. So what we tested, I didn't present these results, were also interventions aimed to affect and intervene on norms and meta-norms. And it seems from our data, of course, they are limited data, so they are just, so it's a survey, but that acting on meta-norms was more effective in letting people to change their behavior and their norms than acting on norms. So one possible intervention and suggestion is that not just looking at norms and act on norms through messages, but also act on meta-norms. So try to let people be more motivated to punish those that do not comply with norms in a distributed way, in a not in a top-down way. And this is relevant because, as was I mentioning before, social norms during the pandemic, some of those were very difficult to be enforced legally. So we need social enforcement. So acting on the social appropriateness of punishing violations might be a way of restoring social norms quickly in the future when they are needed. This is one insight that might derive from our data.
Great. Thank you so much, Giulia. And thank you again, Nicholas, for that question. A question from Juan. And the question is, how much do you think that it could matter that the norms elicited are at the same time enforced by governmental laws? For example, for this looseness of social enforcement.
How much do I think is important? I think that if legal and social norms, so the only way for, I think that legal and social norms, they need to go together. So I think that in those situations in which it's difficult for the government to enforce prescriptions, like in the case of social distancing, it's very relevant that we have these shared expectations and also people willing to enforce, socially enforce. But when they could be combined, I think it's the best way to go, because if legal and social norms, they go in the same direction, that's the best way of achieving the desired behavior. So it really depends whether it's possible also for the government to enforce that behavior. In some cases, it's not. And then we need, I think, to really to work on expectations, make them stronger, and also on meta norms. Otherwise, it's important to align legal and social norms.
Great. Thank you very much, Juan, for that question. We'll give it like another second if anyone wants to raise their hand or ask another question. This is great. There's been a lot of great questions and interaction here. Any other questions? Let's give it a moment. Otherwise, we can turn to one last slide where we can wrap up the session. I think we can go ahead and wrap up. I'll just share my screen just a moment. So yeah, just to wrap up this session, just want to share deep gratitude, Giulia, to you for your presentation and contributions. You can see how folks were really engaged in this discussion. And again, thank you to all participants for your participation and your engagement and questions. We really do appreciate it. And we look forward to everyone's participation in the next Norms and Behavioral Change talk, which will take place on Thursday, November 9th. And the main speaker for that talk, it's going to be Professor George Lowenstein from Carnegie Mellon University. So everyone, please stay tuned for that session. And again, Giulia, thank you for your contributions. And we can wrap up the session for today. Thank you, everyone. Take care.